This video presentation is about the assist. The assist is a nurse who provides immediate care to the newborn by ensuring airway clearance, taking anthropometric measurements, and evaluation of the baby's extrauterine adaptation. These are the materials needed for the assist procedure: a newborn mannequin with clamped cord, a suction bulb wrapped in OS, an eye prophylaxis, a weighing scale, tape measure, 2 tuberculin syringes, which should be wrapped because this is considered sterile, alcohol swabs, dry cotton in a container, a hypoallergenic tape, vitamin K ampule, hepatitis B vaccine vial, thermometer, KY jelly, a diaper, waste receptacle, 2 identification bands, a bonnet, bandage scissors, Ballard's assessment chart or a documentation sheet with Ballard's, and a lined hypotray. To keep our baby thermoregulated during the procedure, we also have a gooseneck lamp. Begin the procedure by performing medical hand washing and open gloving. Suction secretions as needed. Then, apply eye prophylaxis from inner to outer canthus. Before applying the eye prophylaxis, discard 1 squirt first to your gloved hand. In this demonstration, the cap of the eye prophylaxis was not removed, but in the actual patient care, you need to remove the cap of the eye prophylaxis before applying it to the baby. One guideline that you need to remember upon application of the eye prophylaxis is to make sure that the metal or plastic tip of the eye prophylaxis will not touch on the eye of the baby. At this point, we will now take the anthropometric measurements of the baby: the weight, head circumference, chest circumference, mid-arm circumference, abdominal girth, and the length. Before weighing the baby, make sure that the weighing scale is set to 0. Also, you need to remove the flannel before placing the baby to the weighing scale. See to it that a balance indicator is aligned to the center mark. Then, do the reading for the weight. Now, take the head, chest, and mid-arm circumference, followed by the abdominal girth. The landmark in taking the head circumference is above the eyebrows. To take the head circumference, place the tape measure at the center of the forehead, then draw it around to the most prominent portion of the posterior head, which is the occiput. Lift the baby by supporting the head, neck, and the back, then transfer the tape measure to the chest. Align the tape measure on the nipple line, then read the chest circumference. Transfer the tape measure underneath the abdomen. In measuring the abdominal girth, make sure not to include the umbilical cord. Make sure to lift the baby before pulling the tape measure, because pulling the tape measure without lifting the baby will cause abrasion. Take the mid-arm circumference between the acromion process and the olecranon process. Remember these assessment findings because you will do the documentation later on. Remember that the head circumference is greater than the chest circumference, and the chest circumference is greater than the abdominal girth. Even when there are unusualities in the anthropometric measurements, reassess the baby. Take the length by placing the baby to his side and measure from crown to heel following the contour of the body. Next, prepare the materials needed for vitamin K and Hep B administration. This includes the disinfection of the ampule and the vial using an alcohol swab. For the ampule, start from the neck to the top and then for the vial, from the top to the neck. With regards to vitamin K administration, take note that a term newborn will receive 1 milligram or 0.1 ml of the vitamin K, whereas a preterm newborn must receive 0.5 milligram or 0.05 ml of the vitamin K. The 0.1 ml and the 0.05 ml is based on the 10 milligram per ml dosage of the vitamin K. During the aspiration of the medication, do not forget that you should not introduce air to the ampule. And also, please do not remove the cap of the syringe during the return demonstration. On the contrary, during the preparation of a medication from a vial, you need to aspirate air first equal to the amount of medication that you will draw up from the vial. Inject the air to the vial and aspirate the medication. Prepare the hypoallergenic tape before the administration of the medication. Place a cotton ball in between your pinky and ring finger using the alcohol swab. Disinfect the injection site. Take note, the injection site is the vastus lateralis. The medication that we are about to inject is the vitamin K. Take note that this is administered on the left thigh of the baby. Place temporarily the used syringe on the lined hypotray because this will be discarded later on in a tamper-resistant container. Administer the Hep B vaccine on the right thigh of the baby, following the previous steps. Apply KY jelly on the thermometer and take the newborn's temperature per rectum. Aside from taking the temperature, this will also check for presence of imperforate anus. Then, apply the diaper of the baby and make sure that the umbilical cord will not be placed inside. Place identification bands on the wrist and ankle of the baby. Assess the baby using the Ballard's assessment of gestational age criteria. Place the bonnet and swaddle the baby properly. Then place the baby on a crib with crib tag. So do not forget to document the following: the name of the baby, the sex, weight, head circumference, abdominal girth, length, date of delivery, time of delivery, mode of delivery, chest circumference, and mid-arm circumference. Then, document the APGAR score. Do not forget that the 1st and the 5th minute APGAR are required, while the 10th minute APGAR is optional for the institution. Also, the 10th minute APGAR may be required if the result of the 5th minute APGAR is non-reassuring.
Then you proceed with the Ballard's. So I have here 2 samples of Ballard's assessment. If you have noticed, we have here the neuromuscular maturity and the physical maturity. So all you need to do is to crash out the specific cell which corresponds to your findings of the baby. So in this chart, the neuromuscular maturity is 18. Okay, why? Because this is 3, and then how many cells? 1, 2, 3, 4, 5, 6. 6 times 3 is 18. So for the neuromuscular maturity, the score is 18. And for the physical maturity, the score is 17. Okay, so when you add it, that's 35. That's why if the score is 35, the corresponding weeks for that one is 38. Okay, so we have here our table. Now, I also have here an example in which the score does not correspond to a specific week here in the table. So we have here a neuromuscular maturity score of 18 and the physical maturity score is 19. So when you add it up, it is 39. You cannot actually find, it's 37. When you add it up, it is 37. You cannot find a 37 there. Instead, you just have a 35 and a 40. So you just place the 37 here in between the line. And then for the 38 here, you place there 39. So that's how you score it if you cannot find the specific score here in the table. Because take note, the interval for this one is by 5. That's it. Thank you and good day.